Hi, welcome back to So What's Next. My name is Raleigh,
And I'm Ashlyn.
and today we are joined by State Representative Sam Park to discuss health insurance policy in the state of Georgia.
Raleigh, Ashland, thank you so much for having me. Looking forward to our conversation.
Awesome.
Yeah,
Yeah.
wonderful. So, just to get us started, why don't you tell us how you got your start in politics and what inspired you to start advocating for others here in Georgia?
Sure. I am born and raised in Georgia, and growing up in the state, I had never really imagined that I would be running for office. About 10 years ago, back in 2014, my mom was diagnosed with stage 4 cancer. And back in 2014, that's when we were also having the big debate in Georgia as to whether or not we would expand Medicaid, with the Supreme Court then making it optional under the Affordable Care Act. So the big policy issue became very personal to me, in which it was public health insurance, Medicaid, and Medicare that gave my mom a fighting shot given her diagnosis. And so as that policy issue became personal, that really became the impetus for me to run for politics, and the Georgia State House in particular, with the understanding that it is politics that drives public policy.
You talked about this a little bit already, but would you mind expanding on you emphasize the importance of access to healthcare and what really makes you so passionate about this here in Georgia?
Yeah, healthcare, when all is said and done, I think is just very fundamental. If you're sick, or if you're having health challenges, that really inhibits you from working, from living freely in pursuit of your American dream, whatever that may look like in whatever arena. So it really is foundational for all of us. And so for me, there's not just some moral imperative in ensuring access to quality, affordable healthcare, especially when we're comparing the United States to countries around the world where we are the outlier. As Americans, we are one of the few countries in the world that does not have universal health care. And of course, this is also economic. In the state of Georgia, for example, had we expanded Medicaid years ago, that would have brought in up to $1 billion every single year that would have been invested in our healthcare infrastructure. And so we're talking about not just ensuring access to healthcare for hundreds of thousands of Georgians, we're also talking about federal dollars and state dollars to ensure that our hospitals have the resources necessary to keep their doors open. And also, we're talking providers. I've read different studies that said that expanding Medicaid in Georgia would create up to 30,000 healthcare related jobs. And of course, these are oftentimes jobs that can't be automated. And so, healthcare from plethora of different perspectives remains, I think, one of the most important issues facing the state of Georgia.
And then continuing on that note, what do you see as the primary barrier to individuals receiving healthcare access in Georgia? Is it just the lack of, support for insurance, or what is that primary barrier?
I think when all is said and done, from my perspective, the primary barrier to access to healthcare in Georgia is political. It is the lack of political will or political ideology that has gotten in the way of proceeding with common sense public policy to make sure that we are ensuring access to healthcare for every single Georgian. Again, if you compare the state of Georgia, which is, I think, one of 10 states in the country that has not yet expanded Medicaid, we far lag other states in terms of metrics, in terms of not just your, uninsured population, but also in terms of health outcomes. When we're looking at hospitals in Georgia versus other states that have expanded Medicaid, Arkansas being an example, and we're talking conservative and liberal states. Arkansas is a state that expanded Medicaid in a non-traditional manner, utilizing private health insurance, and not a single hospital has shut down in Arkansas, whereas in the state of Georgia, we've had at least 9 hospitals shut down and more that remain financially on the precipice, in part because we haven't done the right thing in ensuring that folks have health insurance, public or private.
So, beyond the state of Georgia, what federal policies have made it more difficult for Georgians to get access to this healthcare?
I think we've seen a lot of attacks, unfortunately, from at the federal level regarding access to healthcare. We've seen multiple lawsuits filed, of course, to undermine the Affordable Care Act. We've seen legislative efforts to roll back key provisions, some of those legislative efforts failing by a single vote. I recall, for example, John McCain voting thumbs down to a key provision years ago that would have really rolled back a lot of provisions. With Republicans in complete charge of the federal government today, of course, we've seen the ACA subsidies now being rescinded that would increase healthcare costs for millions of Americans, I think a million to 1.5 million Georgians, that is going to take effect during open enrollment that begins in less than a month from today. Along with the health insurance access piece, of course, we've also seen attacks against preventative health care, attacks against contraceptives and women's reproductive care. We've seen attacks against gender affirming care. But really, I think it's the principle of bodily autonomy, in which, as a Georgian, as an American, ultimately, I want the freedom to decide my own healthcare decisions between me and my doctor, right? There should really be no place with government involved in making personal healthcare decisions, other than ensuring that we have a system in place that holds insurance companies and medical providers accountable, and to, of course, bring down costs to ensure that access is actually affordable.
And I know you mentioned earlier the closures of hospitals across Georgia. I know that St. Mary's Sacred Heart Hospital recently had to close its labor and delivery unit a few weeks ago. Should Georgians be worried about closures like that? And what is the connection between those closures and policy decisions?
Without a doubt, I think every Georgian should be incredibly concerned about St. Mary's Sacred Heart Hospital closing their labor and delivery unit in particular. When we're seeing hospital closures, not just throughout rural Georgia, but for example, Wellstar in Metro Atlanta, a trauma 2 level hospital, that ultimately results in folks having to drive hours simply to get emergency care. Georgia has one of the highest maternal mortality rates, in part because we've seen so many rural hospitals close and the lack of actual healthcare facilities that provide services, especially throughout the rural parts of the state. But this of course also has a huge economic impact. Rural hospitals in particular oftentimes are one of the largest employers in their respective communities. And if we see a rural hospital shut down, that means the loss of good paying jobs that has cascading harmful economic effects that can really devastate a community. We've seen another example of the lack of access to healthcare resulting in jobs leaving the state of Georgia. Marvel Studios, for example, cited the lack of access to healthcare being one of the main reasons why they moved out of Georgia. That's thousands of jobs and investment that otherwise could and should be here in Georgia that is no longer here specifically because of the lack of affordable quality health insurance for folks.
Yeah, and just one follow up on kind of that. It seems like it makes perfect sense, economic sense for the well being of Georgians to expand Medicaid. What do you think is the reason that some politicians are so resistant to the idea?
It's a great question. For many, many years, Republicans whom I've served with cited the cost of Medicaid expansion being the primary detriment or barrier to actually moving forward with full expansion. Well, I've introduced many pieces of legislation and received many fiscal notes in which if Georgia were to expand Medicaid, that would cost about $100 million to $150 million a year. The state of Georgia could easily afford that cost because currently we're sitting on a $12 billion surplus. Rather than using taxpayer dollars to invest in Georgians' healthcare, we're simply sitting on these funds for no clear public policy reason that I'm aware of. And so, any which way that I look at this issue or assess the arguments of my friends on the other side of the aisle, there isn't a reasonable, logical public policy reason not to expand Medicaid. And if you don't want to expand Medicaid because you're concerned with the underlying program in and of itself, there are alternatives. Of course, again, similar to Arkansas and a few other states, utilizing federal subsidies to cover the premiums for private health insurance for uninsured Georgians. If folks aren't comfortable with that sort of system, then again, I would strongly encourage, my colleagues on the other side of the aisle to look at what other countries have done to ensure access to universal health care with my personal perspective that access to healthcare is a human right, certainly for the wealthiest country in the world. But ultimately, there isn't any clear reason other than politics that is getting in the way of Georgia doing the right thing, in my opinion, especially on healthcare.
Yeah, really well said. I think definitely the partisan divide that we've seen in our country has really sort of caused us to not be able to work forward on a lot of issues. I mean, we're seeing it right now. Our federal government is not functioning because people just aren't able to even get together to pass something as simple as a budget. And I think a lot of these issues, especially with access to healthcare for people, in college, like me in Raleigh, it can feel really hard to sort of find a way to get involved, especially on these important issues. So, how do you see ways as individuals that we can help support access to healthcare in here in Georgia?
I think when all is said and done, and this is certainly a question that's come up in my own mind multiple times over the past year, in which we've seen, especially our federal government, take a lot of actions that a majority of Americans do not support. And frankly, I remain very concerned in terms of the direction of the Trump administration and the path that they are taking us down, which frankly seems to be lawless, if not blatantly authoritarian, particularly in light of the actions that they've taken that continue to be rebutted by the federal courts and by some judges appointed by President Trump himself. When all is said and done, I think it's important in this moment with respect to healthcare, but respect to all the issues that we really care about, to understand that we as citizens remain sovereign in America. It is ultimately we, the people with the power of the vote, that has the actual power to move the needle on all of the issues that we care about. But it requires us to hold our elected officials accountable, but for us to vote for elected officials who are fighting to expand access to healthcare, not just saying that that they care about healthcare, but actually taking action to do so. Politics, as I tell a lot of folks and myself as a politician, having been in office for 9 years, so to speak, don't listen to what we say. Look at what we do. It's the only way in which the people can hold their representatives accountable at all levels of government. But, I think it's very easy in this moment for a certain cynicism and pessimism to creep in which we feel helpless. But I think, if we continue to do nothing because of either cynicism or the feeling of helplessness, we play into, those who want to maintain the status quo's hand. We ultimately retain the power to move the needle on all these issues. We simply have to do our part in organizing, voting, and in some instances, running for office ourselves to make sure that these policies that are so important actually move forward, are signed into law, and implemented.
Yeah, I think that's a great call to action to support these measures. And then yesterday, I got to speak with Emory's newspaper on kind of what Democrats are trying to convey in the context of the shutdown and healthcare subsidies. So I guess in that context, what message do you think that Democrats should be conveying about their emphasis on the importance of these healthcare policies? And in what ways do you think we can do that in the state of Georgia?
I mean, I think it's always a more effective advocacy approach when we are sharing our stories. When rather than saying Medicaid or Medicare or public health insurance, private insurance, that we really level set with people so they understand the personal impact that, Medicaid and Medicare have on people's lives. Again, for myself and my mom's battle against cancer, had she not had access to both Medicaid and Medicare, I would have lost her in a matter of months because there was no way that my family would have been able to afford $30,000 worth of healthcare expenses and chemotherapy that was required for her to have a fighting chance. And my mom ended up surpassing all expectations for life expectancy, given the extent of her cancer. She ended up living about 3.5 years, though she was only given 2 years. And all of that, of course, was because she had access to Medicaid and Medicare. Myself personally, I benefited from public health insurance as a child, in which growing up as a low-income immigrant, my family wasn't able to afford a surgery that I received when I was 17, 18 years old. And it was through Peach Care, public health insurance for children, that I was able to make sure that I could move my hand and address the nerve damage that, I ended up being diagnosed with. So one, I think we have to make it personal. Healthcare is not just a policy fight. This impacts, and really access to healthcare, frankly speaking, is a matter of life or death. If you say you care about life, then that needs to be consistent when it comes to access to life-saving, life-sustaining healthcare. Otherwise, if you say you care about life and you are blocking or doing nothing to expand access to healthcare, or you're actively taking to make it more expensive or to take it away, clearly your stance on life or access to life or the value of life is, hypocritical, to say the least. So one, I think we got to make it personal. Two, we have to hold our elected officials accountable, especially those in the Republican Party who are causing a lot of harm, particularly on the healthcare front with respect to their actions. And three, we have to act ourselves by understanding that we still have the power to do something about this issue and to ensure that healthcare remains one of the top issues, certainly as we go into the midterms next year.
Yes, I think that point about storytelling, we actually hosted Young Dems in collaboration with the American Cancer Society just last week, an event where we had some people come out. And that was one of the things that they mentioned when talking about healthcare policy is making it personal, trying to connect with people on that issue. Because you say all these things like Medicare, Medicaid, and a lot of people have a certain idea of what that means. But when you tell a story of my mother, here's what happened, here's how she was able to sort of overcome this because of this policy. It really contextualizes that. And I feel like there are numerous different avenues that you can take. But I know that one of the points that Republicans like to point out is inefficiencies and sort of this waste in the administration of healthcare. So sort of what would you say to someone worried about their tax dollars being then misappropriated in healthcare?
I would say that it is far more inefficient and wasteful to block access to healthcare, in particular to block access to preventative healthcare as a starting point. We know that, and my mom is another good example of this. Had my mom had access to healthcare and was getting regularly checked, especially at her age, they would have likely caught the cancer much earlier, and rather than have to pay $30,000 a month for years on end, her treatment would have been that much more shorter and efficient. Access to preventative healthcare saves money in the long run and improves healthcare outcomes, as opposed to making healthcare more expensive for tens of millions of Americans. That is not only going to block access to preventative healthcare, but that will drive up uncompensated healthcare costs. Under federal law passed by Ronald Reagan, we have EMTALA. I don't recall exactly what the acronym EMTALA stands for, but essentially this requires that if anyone goes to an emergency room, that emergency room hospital has to provide them services so folks aren't literally bleeding out in front of a hospital. If you have a situation like in the state of Georgia where you have up to hundreds of thousands, up to 1 million folks without health insurance, and they're going to the emergency room only when literally their life is on the line, how are they going to pay for those incredibly expensive emergency room healthcare costs, right? They won't be able to. So the hospital or the emergency room facility will otherwise have to cover those costs. Here in the state of Georgia, we have, I think, almost $1 billion, if not $1.5 billion worth of uncompensated healthcare costs, which is one of the primary financial drains that is causing a lot of hospitals to close their doors. But these uncompensated healthcare costs also increase the private premiums of Georgians who have private health insurance. And so I would say it is far more inefficient and wasteful to do what Republicans are trying to do and make healthcare more expensive, or to otherwise withdraw these healthcare subsidies, as we've seen them do, in which we're now beginning to see the effects of that.
I think you raise a great point with the emergency room, sort of people going there as a last resort. And now, because of lack of health insurance, people are going there sort of as their primary care. I have read several articles recently about how emergency rooms are just so overwhelmed with influxes of patients who are, going there because they have nowhere else to go. They can't get access to a primary care doctor to get those yearly checkups. I read an article just this morning about a boy who was misdiagnosed in a Mount Sinai emergency room and died in his dorm room because they were so overwhelmed that they didn't have the resources to properly treat him. How do you think sort of this larger impact of Medicare, Medicaid across, not just Georgia, but the country is going to have these like ramifications for not just like ourselves, but healthcare workers in the state?
Yeah. One of my primary concerns with what we're seeing right now with these ACA subsidies being eliminated is the cascading effects that you've highlighted, that we won't be able to stop once they begin. If we see up to 24 million more Americans uninsured because they can't afford private health insurance through these ACA subsidies, what impact is that going to have on emergency rooms, right? That means we're going to see more emergency rooms flooded. It's likely to mean that we're going to see more healthcare, uncompensated healthcare costs that may result in more healthcare facilities being shut down over the next year or two, meaning further strain and more limited access to healthcare. And again, it's this cascading effect in which, where do you draw the line? Where does this ultimately end? And again, I think, to a certain extent, as Americans, we've become somewhat used to our dysfunctional healthcare system. And for example, growing up as a low-income son of immigrants, I didn't have health insurance for most of my life until President Obama passed the Affordable Care Act. And, I was taught growing up, we don't need insurance, you got Jesus, right? Which is, again, a great little quip and saying, but in terms of my actual health and the real life impact that the lack of access to healthcare has, again, it's harmful. But again, comparing the United States to every other Western industrialized country, I think of the healthcare system in Korea as well, one of the best in the world. Universal healthcare is not an outlier. We are ultimately the outlier. In other words, this is a problem that can be solved. This is not a unicorn in which no one's been able to figure it out. There's always ways in which we could improve, that we could and should improve, especially if we're able to get to a place in which we do have universal health care. But getting to that point as a starting point is something that, we as Americans, frankly, are just way, way, way behind when compared to the rest of the world.
Yeah, I think that's a good way to look at it, that we are the exception, not the norm across the world. And then the other thing that I've seen recently is some articles discussing how GoFundMe has emerged as a primary care provider, insurance provider for a lot of folks who do not have access to insurance and rely on kind of just the goodwill of other humans to donate to them, which is, not the system that we should have. But I did want to ask about kind of in conversations with people who have heard a lot of misinformation, I'll call it, about the way that healthcare and health insurance works, how do we kind of cut through that noise? I know I watched a video from one of Graham Plattner's not town hall meetings, but his campaign meetings, where someone was discussing how they were afraid of undocumented immigrants, for example, taking their health insurance, using that money. How do we cut through that misinformation in conversations with voters in Georgia?
That's a great question, and one that's also very challenging and difficult. I think in terms of the concern that it is a bunch of undocumented folks, and them receiving healthcare, which they are not, which that is illegal. It has been illegal for many, many years. And it is not the Democratic position that we're advocating so that taxpayer subsidies or benefits go to illegal immigrants. I think, one way is just to kind of look at the real world effect, right? We've seen under both I'd say really the Obama, Biden, and the Trump administration, we've seen lots of deportations occur under all three administrations. I think the difference there is under the Trump administration, we're seeing, deportation occurring without due process in a manner that seems to be more focused on intimidation, fear. But in terms of, undocumented folks now either being deported or voluntarily leaving, they're no longer here, right? And your healthcare prices are still going up, or you're still losing access to healthcare. I would ask my fellow Georgian who may be somewhat cynical or skeptical, or who may be deceived into thinking that it is undocumented immigrants that is the problem, for them to simply look at their healthcare bills. If your costs are going up, it's not because of undocumented folks. The Trump administration's gotten rid of a lot of the undocumented immigrants. If your healthcare prices are still going up, I would encourage them to look at who's in complete charge of Washington, D.C. as perhaps one of the primary reasons as to why their healthcare prices are going up, or why they may be losing more and more access, especially in a state like Georgia, where for the past 22 years, we've been under complete one-party control, that being the Republican Party. Another specific example to provide for folks, I would say, would be to look at Governor Kemp's Pathways program, in which they've probably spent, I think, 2 or 3 times more on administrative bureaucratic costs as opposed to actually using taxpayer dollars to cover hardworking, uninsured Georgians. I think any which way that you look at this, if you simply look at the facts of the matter, as convoluted and as messy as healthcare policy can be, I think at times intentionally so to make it more difficult for folks to hold people accountable. The strategy of blaming immigrants or undocumented immigrants for the woes that you are facing, one, has been a strategy used for hundreds of years in this country and in others. But ultimately, even if you took out undocumented immigrants or immigrants altogether, if we are not addressing the fundamental problems, folks still are not going to have access to healthcare. And even if they do have access to healthcare, it may not be affordable.
We talked a little bit with some people at the Winship Cancer Institute about their funding for research over there, and then with the CDC, and with all the money that's being cut with grants is sort of in the realm. But I don't think people really think about the long-term effects of what this research is going to be doing here in Georgia either. Do you see any way that maybe the Georgia government could step in and try and help support this research, or how do you see that sort of cascading down?
I think the state government certainly has the capacity and the means, if we had leaders with political will and creativity, to continue to incentivize breakthrough research, and certainly when it comes to diseases like cancer. But, I think therein lies the challenge. We currently have leaders who have, by their actions, demonstrated they're more interested in imposing barriers to access to healthcare. As an example, I could very easily draft a piece of legislation at the state level, providing for $1 million for a grant, which one, the state could easily afford given our multi-billion-dollar surplus. But two, the state does provide financial support to research institutions, I think mostly, public schools through the university system of Georgia. And I don't think the state would be able to completely fill the hole left by the federal government when it comes to NIH funding and CDC funding. But I do see a place for the state to serve as a intermediary gap or a stopgap under the current administration. Now, I also serve as general counsel for Positive Impact Health Centers, which is one of the largest HIV/AIDS service organizations in the state of Georgia. Georgia has some of the highest new rates of HIV diagnoses in the country, in large part because the state hasn't really invested in its public health program to the extent in which other states have, in which we've seen their HIV rates drastically plummet. And so the state does have the capacity to do more, but that requires leadership who actually cares about access to healthcare and public health.
Yeah, I think that note is super important to make. We both work with Representative Omar Crawford, who's Emory's representative, and have seen just like how the state can play a role in reducing sickle cell exposure for a lot of, portions of the population in Georgia, but has really not taken that role. And that's something that we want to work on next session. And then I guess a question to kind of wrap us up, a larger question. A lot of this podcast was kind of started and has centered around this idea of how we can organize and find ways to enact change even under the current administration. So what do you think it will take for Georgia to get to the place where it can expand Medicaid, where it can create larger systems for funding research to find solutions to a lot of these problems? What do you think that will take? I know that, Georgia has gone back and forth between the majorities in the state legislature and whoever holds the, governor's mansion. But what do you think it will take for Georgia to get to that place?
I do think the numbers are there in Georgia for us to elect, for example, a Democratic governor next year, along with Senator Ossoff. I think the numbers exist in Georgia, and I think a majority of Georgians who today, Democrats and Republicans, who support expanding Medicaid. But, for example, I think over the past few election cycles, we've seen the highest participation rate level out around 65, maybe 70%. In some districts, that still leaves a third of eligible citizens out of the voting process. Either they haven't voted or they feel their vote doesn't matter, or for whatever reason, they feel too powerless or cynical not to vote. But there are, Georgia still remains a swing state. Trump won the state of Georgia by 100,000 votes in 2024. President Biden won the state in 2020 with approximately 11,000 votes. The electorate in Georgia continues to dramatically changed and remains very, very dynamic, where when all is said and done, my theory of change remain centered in and around the ballot box and the power of the vote. I abide by the principle of John Lewis that the vote is the most powerful change agent we have in a democratic society. And if we want to see change in public policy, certainly when it comes to healthcare, but on a range of issues, we have to utilize the power of the vote. And where does that begin? I think Deborah Shigley was a great example in which in a 70-30 gerrymandered district, she poured her heart, soul, blood, sweat, and tears into that race, along with y'all knocking doors and stuff. I've seen, y'all doing good work out there. That goes a long way. That was ultimately a 10-point swing in a gerrymandered district in which, yes, even though she wasn't able to win, we still have that many more voters who are otherwise engaged, who may now be engaged to vote in the 26th election. So for me, I think it starts from the ground. And I think it starts with the folks in our immediate circles, whether it is our family, our friends, our classmates, our neighbors, but it's from the ground up that I think the change and the long-term sustainable change will come from. It's not a matter of a silver knight or a single person coming in and saving us from this moment of crisis. We have to save ourselves, and we have the power to save ourselves. We just can't forget that we have the actual power to do it. And part of it is just having one-on-one conversations with the people around us, jumping on we really can't underestimate the power of the vote or our own individual power to effectuate people turning out. And, I think for me, like my own story and example is a perfect example of this. Back in 2014, or back in 2016, when I first ran for office, I probably had a 5% chance of winning. 5% chance of winning. I was running in a leaning Republican district, running the same year with Trump on the ballot. It was a big Republican wave year, and yet I was able to unseat a 3-term moderate Republican chairwoman by simply knocking on people's doors, especially those voters who had never voted or never been engaged, but was able to turn them out. Why? Because I shared my story, and by sharing my story, I was able to build trust through empathy, with the understanding that they had also gone through a similar experience and understood the importance of having access to healthcare. But it was through that process and finding the common ground necessary to build that coalition that I was able to ultimately win almost 9 years ago. For me, when all is said and done, the power of democracy, American democracy, I should say, remains vibrant, but it requires participation from us, from we the people. And so I think that if we continue to lean in, and as every new generation who comes of age begins to really lean in and exert their individual and collective power, I think that becomes the path forward for us to ensure that our government is simply doing what the preamble of the Constitution says that it does, which is to ensure our general welfare and our safety. So, I think the road ahead is long, but there's still a very, very clear path in my mind, which is turn out folks, empower them, educate them, and get them to the ballot box.
Yeah, I think we'll have to make this mandatory listening for our club members. So to encourage them to help us register people to vote and go door knocking. But yeah, I think that's a very important message to make. And I know that, I'm raised in Nashville, Tennessee, which is a state that is just historically low levels of voter turnout. And, knocking on doors in Tennessee is, sometimes even harder than Georgia just to try and get people civically engaged. But I know in Georgia, it is also a struggle in registering people and getting them out to vote. But yeah, I think that's a very important message to get across.
Very good.
Yeah. Thank you so much for joining us. I think we've had a great discussion, have a lot of good points to discuss. Yeah. Ashlyn, anything else?
No, just thank you again for hopping on with us. I think this is definitely needed right now, just with everything that's going on. I always enjoy these. So thank you so much for your time.
Thank you. Well, Ashlyn, Raleigh, if I may say, one, thank you for all the good work that y'all are doing to try and bring attention to these issues and to educate and empower the next generation. And two, again, it takes all of us. And for whatever odd reason, I do remain optimistic, and that so long as we remain anchored and grounded to the purpose that, we are the stewards of American democracy, today. And if we utilize our power, yes, we will get through this very challenging period of time. And I also believe that we will come out stronger and better for it.
Yeah, I think it's a great note to end off of. Thank you so much for being here. We will see y'all next time with State Senator Josh McLaurin on his upcoming race and his hopes for the future of Georgia politics. Thank you so much. See y'all later.